Hello and welcome to another episode of Functional Friday. Joining me today is Anthony Pasek from the Wellness Connection. Welcome, Anthony. How are you?
I'm great. Thanks, Becky. Glad to be here.
Good. I'm going to go ahead and put our little disclaimer out there right now. These interviews are not here to prescribe or to diagnose you by any means. They are simply here for you to hopefully gather some information, ask yourself some questions, and start finding some resources out there. Ask your doctor that you're working with some questions as well, or start seeking out a doctor that is right for you. So in doing this, let's go ahead and start today's topic. Today is all about diabetes. This has been one on our list of topics that we've wanted to talk about, and Anthony just seems to be the right guy to talk about this too. So welcome. How are you?
I'm great. Thanks for having me.
Can you tell us just a brief little bit of background about yourself, where you practice, who your main clients are that are coming in to see you?
Sure. So I am a chiropractic physician. I've been in practice for 7 years. I have training in neurology, functional medicine, nutrition, all kinds of stuff. Just kind of a learning nerd. So I am at the Wellness Connection with Dr. Olivia Joseph in the functional medicine department. That's in O'Fallon, Missouri, right on Highway K. And my main clientele is patients with diabetes. We have a large patient population there. As a practice, we also specialize, as you've talked with Dr. Olivia about before, thyroid issues, hormone issues, autoimmunity, gut health. Those are kind of our biggest patient populations.
Yeah, I feel so smart being surrounded by so many smart doctors like yourself. When I also like doing these interviews because I like to say that I am more like the person that doesn't really know much of anything. I know just enough to kind of be smart enough to sound like I know what I'm talking about, but dumb enough to really not really know what I'm talking about. So I like asking the questions kind of coming from a place of not really knowing. So when we're talking about diabetes, we're talking about type 1 and type 2. Can you explain what the difference is in those?
Sure. So really, I think you hit a good point there. Diabetes is not just a disease. It's really sort of a family, a group of diseases. And some of those, like type 1, actually fall on a spectrum. If we were to get really basic with it, type 1 diabetes is an autoimmune disease. So your immune system can attack different body parts, and based on what tissue it attacks, it gets a different name. So if your immune system is attacking your thyroid gland, it could be called Hashimoto's disease. If it's attacking your joints, it could be called rheumatoid arthritis. If it's attacking your intestines, it could be called ulcerative colitis or Crohn's disease. If your immune system attacks your pancreas, it can be called type 1 diabetes. Now, usually that comes on in kids. Sorry, go ahead.
Go ahead. I was just going to say it was known back in the day as.
Right. It used to be called juvenile onset, childhood onset diabetes. I'll come back to that in a second. Type 2 diabetes is different. It's not an autoimmune disease for most people. It's actually, what a better name for it would be insulin resistance. And we'll go into a little bit more detail on that later. In the past, we used to call type 2 diabetes adult onset. It's really a lifestyle disease. It can be from eating inflammatory foods, bad gut health, toxins in your environment. There's lots of causes for that. But with our standard American diet growing, with people not eating food like you have at Symbol, they can actually get type 2 diabetes very, very young. So we no longer use the word adult onset diabetes for type 2 because so many children, even in their teens, actually have type 2 diabetes now.
So when we're talking about type 1 diabetes, you had mentioned that it was known as juvenile diabetes. However, from my understanding, you don't have to be a juvenile to diabetes. So what are some of the indications that start arising if you might have diabetes?
For type 1, like as an adult?
Yeah, let's talk specifically type 1 right now.
So usually, for most people, it can kind of come on fairly suddenly. So you might have really rapid weight loss, being thirsty all the time, urinating all the time, being very, very hungry. Really, you might not have any symptoms at all. But the underlying issue is that your immune system is attacking your pancreas, and that causes your blood sugar to go up quite a bit. It can be slow, it can be fast. It's really very variable. But just like all autoimmune disease, there's common triggers for that. Gut health, toxins in your environment. There's also genetic predispositions, but you can't really do anything about that.
Right. Greg, my partner, not everybody knows this, is actually type 1, and it hit him right, I believe it was right at about 30 years old.
Yeah.
So he had it just prior to me meeting him and getting to know him. So he is type 1. A lot of why we focus on food in the restaurant, the way that we focus on it, is because of his diabetes.
Yeah.
Managing his blood sugar has always been there. It's why we use agave as a sweetener in here, is because it's a low glycemic. It breaks down like a fruit does. So that's just a little bit of information on the symbol side of things and why we do some of the things and hear the way that we do. Let's talk about type 2 diabetes. What are some of the symptoms that somebody might start having arise, and what would then cause them to go in and be diagnosed with type 2 diabetes?
I'll tell you quite honestly that most of the time there are no symptoms at all. Someone goes in for their annual checkup, they get a blood sugar test, maybe a fasting blood sugar, and it's a little bit high. It could be like that for a few years in a row, and then the doctor says, well, maybe we should check your hemoglobin A1C, which is the main measure for your average blood sugar over a period of time. If they check that hemoglobin A1C and it's high, they might say, oh, well, you have diabetes. And I can't tell you how many times I've had patients say, well, they just said I had diabetes. I had no idea. I didn't have any symptoms at all. But,
so with type 2 diabetes, how do you then treat it? You go in and you see a doctor, because from my understanding, and a lot of people that I know, they just start taking insulin. Is that the answer to it, or what are there other options?
Well, it depends on who you ask, right?
Well, I'm asking a functional medicine doctor who knows the world of medicine. So we'll go from somebody is going in and seeing their regular family practitioner doctor, and then somebody who is working with a functional medicine doctor.
Typically, from the conventional medicine side, the treatment is just woefully inadequate. So they'll say, take this pill, eat right, exercise. That's it. They don't tell you what eat right is. They don't tell you what exercise is. They might tell you to follow the food pyramid. The dietary guidelines are horrendous. And typically, it's just you're going to be on this pill for the rest of your life. You mentioned insulin, which is important. Most people don't start on insulin unless their A1C is high enough.
Okay.
But typically it'll be a pill. If their A1C keeps going up, another pill, another pill, another pill. But as far as the functional medicine side goes, we will absolutely, number one, start with the kitchen. You have to eat an anti-inflammatory paleo diet, if you will. Almost for some people, we tend to start on more of a stricter, like autoimmune type protocol, just for the initial phase. And then really it's detective work, trying to get to the bottom of what.
I'm going to ask this question because I know that this is what some people are asking. Paleo and autoimmune, there is a little bit of a difference in those two. And you just explained paleo and then said probably more of an autoimmune. Can you explain what specifically paleo is, what you're eliminating in paleo, and then what in addition would you be eliminating with AIP specifically?
Sure. So a paleo diet is basically grain-free, dairy-free. That's really it. So you're focusing on vegetables, fruits in moderation for people with blood sugar issue, meats, fats. That's about it. Now, autoimmunity, when you do an autoimmune type protocol, you tend to go a little bit further. This isn't all, there's no like 10 commandments for this stuff. There's gray area, as you know, trying to build your menus out. Typically, we will remove eggs and nightshades, which are tomatoes, peppers, eggplant, things like that. And for some people, nuts and seeds and things like that.
Okay.
Those are the differences. But it's a template. There's always room to move and room to guess. But we also do for specific foods as well.
And I think that's the importance with the functional medicine practice, is that there is, like you had said, there isn't like a blanket rule. There isn't a 10 commandments. It's looking at you as an individual and identifying specifically what your needs are. And I also like to say that it isn't the doctors, the regular physicians out there that are not functional medicine. This is not their fault. They literally were never educated when it comes to food. And that's part of my passion, and the reason behind what it is that we're doing with this is we need to start understanding that food plays in a huge role in the longevity of our life. And I tell it to my kids all the time, and now it's like, it's so funny. I want to do a blog, or I want to do something about what I would do differently now raising my kids, you know,
Yeah.
if I knew everything that I knew now. But then when I got into my 30s, you know, my late 20s, early 30s, I started studying and practicing more natural health. I worked with the naturopath. And I started making some changes. However, you know, my kids are now at college. I don't have control over it. They say, Mom, you were never a pantry mom, meaning I didn't have the Susie Q's and the Little Debbie's and all of the fun foods that all their other friends had. But now they're going away to school and I have no control. So let's talk about that a little bit more. Let's say you're raising a child, diabetes runs in your family. Yeah. Whether it's type 1 or type 2, how do you start making some shifts and changes for your kids so that this doesn't wind up happening?
Yeah, that's a great question. I guess one way to think of it would be sort of like a proactive model of healthcare, which is sort of what we work at with patients who do not have an acute condition. So let's say somebody comes in and they had diabetes, their numbers get great. They get off their meds, they want to maintain where they're at. So we basically, realistically, they're on a paleo template diet for the rest of their life. That's just a good human diet, period. That's sort of what we were evolutionarily, genetically designed to eat. But we can do things like a comprehensive blood panel every 6 months or 12 months. Watch your markers. If they start to tweak up a little bit, you have to figure out what's going on, do some further investigation. So realistically, when you start where you're at, if they don't have anything going on, that would be a good model. You know, just do periodic blood work from a functional medicine perspective. You know, eat a clean diet. Basically, a paleo template would be a good start. And then focusing on other factors like stress management, making sure your gut health is good. If you do have to take something like an antibiotic, working on rebuilding the gut flora after that. Making sure sleep hygiene is a priority. That kind of falls in with stress as well. Just all the basic stuff to be a good, healthy human.
Sleep seems to be coming up every time I talk to somebody, and I quite frequently, is the amount of sleep. How many hours of sleep should somebody be getting on an average night?
The best answer that we know now is 7 to 9 hours for every human. But kids, and especially teenagers, need more than that, without a doubt.
My son can sleep until 12 o'clock in the afternoon. Then we can get into the car, and 20 minutes later, he is asleep for another 2 hours. And then this is like a constant thing. However, I also know that there are some nights, often nights, when he's working the next morning and he's up until 2 or 3 o'clock in the morning and he's only getting 5 hours of sleep. So, so you're saying, I guess my theory in it is if you're sleeping and you're just naturally sleeping, it's probably good for you. You need it.
Absolutely. Yeah. We could do a whole half hour on sleep. There's a lot to go into with that, but some basic stats on that, like even one night of sleep deprivation makes you more insulin resistant the next day, which will make your blood sugar go up. So if you're chronically sleep deprived, that could be the main cause of your blood sugar going up and your diabetes, even if you do everything else perfectly.
So what about type 1 diabetes? Can that ever be managed by food alone?
That's a fantastic question. It depends on who you ask, but I have seen it change because type 1 is a great example of a spectrum within a single condition. So as we mentioned, it's an autoimmune disease. Your immune system will attack the cells in your pancreas that make insulin. We didn't really get into this, but insulin is kind of like a key that opens up a lock on a door to let blood sugar go into the cells in your body. When insulin, that key, does not turn that lock and open the door, the sugar can't get into the cells and it stays in the blood. That's called insulin resistance, right? So back to type 1, insulin resistance is type 2. Type 1 is you don't make enough insulin, so there's not enough keys to open the locks. So you usually have to take insulin. However, your immune system doesn't just totally destroy your pancreas in one swoop. So it depends on how far along in that process, how much of the pancreas has been destroyed, how little insulin you are producing.
Is there a way of finding that out?
You read my mind. There is a test. This is like my mission in life, to let every single person, especially anybody who has diabetes, know about this test. It costs $18 out of pocket at our office. It's called C-peptide. It is a test. You go to Quest, they take a tube of blood, it comes back. It will tell us, are you making insulin, yes or no? And it is sort of a, shades of gray. It's not, it can be a yes or no, but it can be like, you're making a little bit, or no, you're making none at all. So if you are making some still, and we really get to the root cause of what is triggering the autoimmunity, absolutely. I have seen people with type 1 who are on insulin get off of insulin and maintain the pancreas function that they have left still. But the longer you have it, the more you're not addressing the underlying causes of autoimmunity, the more likely you are for your pancreas to lose all of its function, and you'll be doomed to be on insulin. However, even then, if you're eating McDonald's every day, you're going to need more insulin. If you're eating at Symbol every day, you probably won't need that much.
I never ask you doctors to plug us, and you always, always do. So we appreciate that. Again, we really started pulling these interviews together because we identified the functional medicine doctors out there that were sending their patients in to eat with us, and then started identifying that people were devaluing food, where it comes from. Yep. And I mean, when you see a $1 menu at a drive-through McDonald's, or the coupons out there, and people are always wanting to get the next deal on food. We said we need to start educating people in this area, and working with the functional medicine doctors just became a perfect fit for that. One, you guys are sending patients into us, and we have people walking in the doors that we're going, there are other things out there. We're seeing them struggle. So if that's happening, we know that there's even more people out there that this is happening with. So again, this is all about just educating, getting gathering more information, and hopefully then weeding through some of these things. Let's talk about long-term effects in either type 1 or type 2 diabetes. If you don't do the things, take your insulin, eat correctly, what are some of the side effects that you can look at long-term?
Yeah, well, the short answer is you're going to die sooner than you would have otherwise. It just depends on how. So of the top 10 leading causes of death, I think 8 of them are directly related to diabetes. Heart disease, liver trouble, cancer, just go down the list. All of those things can be end products of uncontrolled diabetes. Even, we didn't get into it, but you talked to Dr. Charlin last week, and absolutely Alzheimer's, there is a subset of Alzheimer's that is type 3 diabetes. We didn't really talk about that, but surprise, there's type 3 as well.
Okay, so let's tip on that a little bit. What is type 3 diabetes?
Well, we now know that Alzheimer's, like diabetes, is actually a group of diseases. And the protocol that Dr. Charlin studies and is trained under by Dr. Dale Bredesen, he has classified about 5 different types of Alzheimer's disease. One of those is related to uncontrolled blood sugar. It's basically brain diabetes is one way to think of it.
Okay.
It's scary. But in addition, kidney failure, losing your eyesight, getting wounds that get infected, have to have amputations, all those things are
okay, that was what I was going to ask about, is what about where does the amputation part come from? Because those are some of the side effects that I know of when it comes to people with diabetes and long onset diabetes and having a foot have to be amputated. Why is that happening?
Yeah. The way that diabetes destroys every part of your body is with high blood sugar. That high blood sugar will destroy the tiniest little blood vessels in our body. And that also will cause neuropathy. It kills the nerves that are fed by those blood vessels. So a lot of people with diabetes have tingling in their feet or tingling in their hands, or they can't even feel their feet at all. That reduced circulation means even if you're cutting your toenails, there are podiatrists that specialize in cutting diabetics' toenails to make sure that they don't get a wound that gets infected. So they have to be amputated. It's pretty sad. The small blood vessels being destroyed damage your kidneys, your eyes, the nerves in your feet. If you get the smallest little wound, there's not enough blood flow to bring immune cells to that area to heal and repair it. You can't fight that infection, and that infection just grows and grows and grows. What's worse is you can't feel it because you've got neuropathy. So then it just gets worse and worse. You could stub your toe and get a wound. You wouldn't even know it's there. You look a week later and it's infected and it's gangrenous. It's very.
Yeah, I was going to say that it just does not sound. Okay, so let's talk about food a little bit more, because what we're saying is that we're talking about with diabetes, whether it's type 1 or type 2, it's blood sugar.
Yes.
So the more sugar intake, the more apt you are, or the more higher your blood sugar levels wind up being, the more medicine you wind up having to take, correct?
Sometimes.
Okay,
Yes.
Correct me then.
Yeah, well, absolutely. So if you sat there and just mixed a bunch of sugar and water and drank it, your blood sugar would go up. However, that's where it's a little tricky, and you have to go a step deeper, because we have some patients who eat perfectly great and clean, and then their blood sugar is really high, and then they eat garbage and their blood sugar is normal. So sometimes there's a little bit more nuance to that, and you have to look at other underlying issues like gut health, infections, nutrient imbalances, all that stuff. But certainly, as a general rule across the board, if you're eating sort of an anti-inflammatory diet, and then typically more of a low-carb version of that, that will tend to keep people's blood sugar down. But sometimes it doesn't, and that's where we come in.
And I think that that's what I kind of want to go into, because again, we're talking to, I think oftentimes when we're talking about high blood sugar, or we're talking about eating things that are low in sugar, we're thinking of the white grainy sugar specifically. And that's not what we're talking about. We're talking about so many different things that turn into sugar.
Right.
So can you explain what those food groups would look like that would be turning into sugar into your body?
Yeah, and I'll mention that, but then I do have a segue into like gluten specifically.
Right.
Basically, any starchy vegetable, which would be like potatoes, sweet potatoes, root vegetables, things like that. Broccoli, leafy greens, those do not count as carbs. Fruit, stuff like that. Any kind of grain, really. Anything made with flour, anything made with rice, all those things will turn into sugar in your body and will, for some people, tend to make them go up. However, when we talk about food sensitivities, that can be a cause of blood sugar going up, or food intolerances. So it could be eggs for somebody. It could be, it could be avocados. It could be food that we think is healthy, but for that person at that time, if they eat that food, it could cause inflammation and make their blood sugars go up. But gluten specifically, we definitely need to do a half hour on gluten, because that's a whole spectrum of sensitivity too, and it is way more common than people think. It's not celiac disease.
And I was going to say, I like explaining gluten is, it doesn't mean you have celiac disease. Celiac disease is one specific spectrum of it. Gluten intolerance, I think as Americans, most of us are walking around with a gluten intolerance of some kind. And I like to I say this, I think in almost every video, is I challenge anybody listening to this to give up gluten and sugar 100% for 1 week, just 1 week. And you identify so many shifts physically and mentally that then you can start seeing how it's really affecting you.
Yeah, that's great. I would say 30 days or 6
I
weeks.
know everybody says 30 days, but to Joe Schmo watching out there, 30 days might sound too long. I challenge you to 1 week, and then if you choose to, go 2. And Doc says go 30 days.
But just to touch on gluten again briefly, but I really think we should go into that. You could have 0 symptoms and still be, and your life can be shorter if you eat gluten and you have a gluten intolerance with no gut problems, no skin issues, nothing. So there is specific testing that is very beneficial for that, but that's for another day.
Yeah, we will definitely do that. Let's go ahead and wrap up this segment because we've gone to our time, and we could keep just asking more and more questions. Anthony, I want to thank you greatly for joining us today. Please make sure in the comments you put your contact information in there, a link to the Wellness Connections. And I like to say that we met here at Symbol thanks to Lacey, a mutual friend of ours. You were at one of our doctor's dinners, and I think if I remember correctly, you were looking for a place to go work at. And I don't know if I specifically connected you.
You did. Take all the credit for it.
I couldn't remember if it was that or if it was just like in linkage or something like that.
It was all you.
I
give you a long distance hug.
a little hug. But that's what we do. That's why I love doing what it is that I do, because I love connecting people, whether it is the customer walking in the door with resources to be able to find the right doctor that's right for them, whether it is somebody that's walking in the door and saying, hey, I'm looking for this life change. That's just what I do on a natural basis. So Anthony, thank you for joining us today on Functional Friday. If you did not catch this live, no worries. We archive all of these onto our website at www.mysymbol.com under Find Your Inner Flavor and Podcasts. You can go back and you can watch any video that you're looking for in there, more specific as well. Every single Friday, usually every single Friday at 10:30, I'm interviewing another doctor, whether it's here in the St. Louis area or around the U.S. If you have a topic you want me to touch on or a doctor specifically, make that connection and we'll go from there. Anthony, thank you again, and we will talk to you soon.
Thank you, Becky. Have a good day.